I would like to greet everyone who is going to watch this video. Today, as written on the board, it's, let me fix it better. Sorry for that. Okay. So some technical problems I have, as always. When we do YouTube, nothing is like 100% perfect. We always have to adjust all the time. So again, my name is Yanick Dantiste. I am a family nurse practitioner who has been working in West Palm Beach, Florida, since 19. I've been living there since 1990, but I've been a family nurse practitioner since when? Since 2001. And yes, so again, today is Sunday 14, 2022. The topic of today will be skin and hair problems. Okay, so the title is the most common skin and hair diseases. So that's what we're going to be discussing today. As usual, I would like to start with an inspirational words, or we can say quote, doesn't matter. Something to lift us up, something to boost our mental, our psychic, because so many things been happening in this world. As we can know, it doesn't matter wherever you live, there's something. So um, I think those inspirational quote or words helping to lift up our soul. So that inspirational quote or words state like this: you might not have the things you want, but if you check carefully, you got all you need. And which is so true. I'm going to repeat it again. The inspirational words today, it's stating like this: you might not have the things that you want, but if you check carefully, you got all you need. Okay, so if you have a roof over your head, if you have food to eat, um, let's say if you have a job, or let's say you have a car, or you are in a city that you can take buses, you take a bus, so you have some, you might not have things that you want, but at least you have things that you need, and we need to be grateful for that. So having said that, let's dive in on the topic of today. So again, the topic will be: what are the most common diseases of the skin and the hair? Okay, so skin and hair disease. I mean your hair. So I'm going to write it down, because some people, they are visual like me. If I see something, if I don't see something written down, I will never remember it. But if I see it, it's always, in my mind, and I will keep it and remember. So the purpose of my teaching, okay, is to give knowledge. I mean, how to say that, is to teach people about. It's mostly teaching, educational. Is to teach people whoever wants to, about different system of in your body, and what the most common disease goes with those systems, and what are the sign and symptom, and which provider or which specialist you need to see. So I think simple thing like that, somebody knows that. I think that will help you a lot. That will help to speed, to speed um, you know, to speed your the treatment, to speed how fast you can see your provider. So that will help. So that's why I think it's important people knows what kind of system in your body is affected, and what kind of disease they have, and also what kind of sign and symptom, you have to look for. And also we have to remember, medicine is not how to say that, medicine is not a specific science. Okay, let's say mathematics is very specific, it's very um, specific and direct. Let's say we said 2 plus 2 is 4, right? 5 times 2 is 10. But medicine is not like that. Medicine, you might have symptoms, and that symptom can be caused by so many diseases. So that's why only one symptom is not enough. But if we know exactly what system can give that symptom, and then we have more than one symptom, we can uh we can discover, or we can pinpoint, say, okay, I have that symptom, like nausea. Like say nausea, vomiting, mostly is GI, but sometimes it can be the brain too. So that's why it's not specific. But more knowledge we have, it's more informed consent, or more informed decision we can make. Okay, so this is my main reason for that. It's just to for acquaintance. It's to really help people to acquaintance about different diseases in different system, and then to um, go and seek for help, and the right help. So sometimes the help they go to see is not the right one. So you need to know exactly what kind of provider. It's like the topic of today, the skin and the hair. Excuse me. Most of the diseases, the provider, the primary care physician can treat. But if it's really severe, it's better you go to see a skin doctor, a dermatologist, or if it's regarding your toenails, a podiatrist. So it's not really one thing. It's it depends what you have and who you need to see. So let's dive in, okay? So what are the most common condition of the skin and hair? So so just for the skin and your hair, we have like more than 20 diseases which will related to that system. So okay, so diseases of skin and hair. As we goes along, I mean, like right now, I just started like what, one few months ago, not even so, less than that. So as we goes along, we have live participant, so they can call me and ask questions, and then I will answer those questions as as much as I can. And if I don't know it, I will tell them that I'm going to research, and then I can come back with those answers. So disease of the skin and hair, what are they? The most common one, we might have more than that, but the most common one, okay, is dermatitis. This is one, dermatitis. So what is dermatitis? Dermatitis is a very loose term, okay? It's loose. That's meaning it's broad. It's a very broad and loose term. So it's often used interchangeably with eczema. Sometimes people use the term dermatitis and also they think it's eczema, but it's not really. It's not the same. Okay, um, so usually that disease, okay, is used to describe an inflammation of the skin caused from any causes. It can be from exterior causes or interior uh, causes. So it can be exogenous dermatitis. It's caused by external factors such as washing powder. Okay, that can cause that. Um, and also it can cause by endogenous form. That's due to internal damage problems. So that can include that metabolic disorders, scratching. Okay, so scratching always aggravates dermatitis and may also cause infection. So that's why when we have inflammation of the skin, we always tend to tell the patient do not scratch. I know it's hard because once you have the inflammation, the first symptom is itching. But if people kept scratching, you might have infection. It can cause infection. And also there's different type of dermatitis. The type of dermatitis can be diaper rash, especially from the baby, but that can be also um, elderly elderly person. We don't use the term diaper, we use the term briefs, okay, for dignity, because they are not babies, they are adults. So we use incontinent brief. So the elderly also, the older person also, they can have diaper rash if they use briefs. Um, uh, so because of the urine, so if the urine sits too much, on your skin, that can cause dermatitis. And also we have also infantile eczema also. But we're going to speak after about eczema. So they use dermatitis eczema. They change it. They think it's the same thing, but dermatitis is dermatitis. Eczema is eczema. Believe me, because I've been seeing so many of them. It's not the same. As a matter of fact, I suffer from eczema since I was 13, so I know exactly what eczema is, and it's not the same. So dermatitis mainly is inflammation of the skin. Okay. So what are the symptoms? The symptom is redness and blistering. So you can have redness and blisters, and also swelling, can be weeping also. Okay, like fluids come from that lesion, and crusting the skin. The skin can become crusted because um, people tend to scratch when you're itching, which is this is a natural, reflex when you're itching. Sorry, itching with a strong impulse to scratch, and also people can have burning sensation. So now let's let's get into eczema. Ooh, okay. Sorry, my computer is giving me trouble. Okay. So the second one is eczema. The second skin disease. Okay, you can people can have. So what is eczema? Eczema, as I said before, they also call it dermatitis. Usually, we can people interchange it. It's an inflammation as well of the skin that cause itching and redness. This is eczema, and it is a feature of many different skin diseases arising from many different causes. So that eczema can cause eczema. The causes can be different. Okay, it can be food, can be hereditary. So eczema is only infectious if it is become secondarily infected. So that's why once you have it, it's good to go to see a skin doctor, a dermatologist, primary care physician or provider. They can treat that also because um, depending how many they've been seeing, so they can treat that. But if they see they cannot treat it, if they cannot control the eczema, they will refer you to a dermatologist. Also, we have different type of eczemas. We have contact eczema caused by uh, allergens such as plant, metal, detergents, and chemical irritant. So, things can cause eczema. Let's say plants. Okay, we know like uh, IV plants can cause, if that touch your skin, you can have the eczema condition. And also, we can have something called also atopic dermatitis as well. So there are different type of eczema. Okay, what are the symptom of eczema? The sign, a symptom. What is the manifestation? So how do you know you have eczema or something else? So eczema is red, scaly, crack patches of skin. Particularly, you have eczema on your hands, you have it on your ears, your feet, and the legs. And also, you can have it in your elbow or your, inside the crease of your elbow too. That's where I used to have eczema. Um, so, and they said in children, you could have small fluid filled blisters which may burst to form sores. Okay, so eczema, once you see it once, you know it. Okay, so it's red, scaly patches. So you sometimes they have some blisters. So it is very, very itchy. So that's eczema. So the next one is psoriasis. The next one is psoriasis. The psoriasis, sometimes people confuse it with eczema. It's really two different skin disorders. Um, so do not confuse it, but the same the provider, mainly the specialist, mainly the main specialist who who uh, who is expert on skin and hair disease is dermatologist, right? Dermatologist. So this is the specialist. Especially if you have health insurance. Let's say you have health insurance and your health insurance, you are PPO. Um, I think you can directly call, the specialists and you go to see them um, because this once you have the skin disease, it's so itchy, it's so uncomfortable. The timing is very important. You go help as soon as you can. So if you have health insurance and you have PPO, you don't need to wait for your primary care doctor to give you a referral so you can go and see a specialist. You can by yourself. You can call, the skin specialist who is the dermatologist, and you go to see them, which can be faster. Your treatment will be faster and you will have a faster relief. So what is psoriasis? Uh, Psoriasis is a common skin disorder which may affect any part of your body. Most common, uh, often most common is affect the elbows, okay, like this, the knees, the chin, your scalp, and lower back. This is the most common places. Um, this is the most common places people have eczema. So, what are the symptoms of what is the sign of symptom? What are their manifestation? How they appear? So they said the sign of symptom that individual will have pain rather than itching. So remember, eczema is itching, right? Most of the same with eczema is a lot of itching, but with psoriasis is more pain. With crack appearing in the dry area of the ends and feet. Also, you can have you people going to have pustules, which is feel like lesion but with pulse, not with fluids on the palm of the hands or sole of the feet. Okay, so we call that pustular psoriasis. And glaze, but not scaly plaque. So the plaque is glazed, so like shiny, but it's not scaly. Okay, and also they can have distortion and pitting of the nails in some cases when you have psoriasis, which eczema, you don't have that. Um, the next one is it's no, sorry, where's my stuff? The next skin disease, I have to erase some, I think. Well, no. The next one is utic urticaria. Utic, urticaria. What is that? Urticaria is an allergic condition also known as hives. Okay, so it's the same thing with hives. Um, so you're going to have a rash. Okay, the rash of is raised. You have whitish yellow area of your skin surrounding the red inflammation is caused by the release of histamine. So that's why we know that it's an allergic reaction. Once you have histamine cells, that's allergic. Um, so that can cause by different thing. Different thing can triggers that, such as heat, cold, sunlight, scabies can cause that, bites. Okay, so many things. So how they manifest, how you carrier or hives, what are the signs and symptoms? You have rash of wheals, especially on your limbs, which is your arms and your legs. Okay, both arms and both legs and your trunk. You have intense itching. Urticaria is very itchy. Also, you can have swelling of your tongue, of larynx, also, and that can also interfere with your breathing as well. Okay. Also, that individual can have they can feel like they have fever, like heart a little bit, and can also have nausea. So this is sign of symptom for urticaria, which is hives. The next one is, let me erase the top, which I don't like, but I don't have a choice. Um, the next one is pricky. The next skin disease, we call that prickly heat. Okay, prickly heat. So this is not very common skin disease we hear, you know, about it, but it's there. Okay, people have that. What is it? A prickly heat or rash or heat rash. We call it heat rash as well. Occur as a result of sweat duct blockage. So when your sweat duct, your duct where your sweat they are coming from, when they block, so that's when you having the prickly heat or heat rash. Um, in particularly that happen in hot or very humid weather. Okay, so it produces a rash of red spots on the face and or the body, which usually disappear within hours of the software moving into the shade. So once the software, you want that individual move into the shade, that heat rash disappear. Um, they said also sometimes, however, sometimes it may develop into patches of eczema. Children and elderly and the obese, they all can be affected. Okay, mostly children, elderly, and obese person. So, what are the symptom of sign? What are the sign of symptom of prickly heat or heat rash? It's a constant prickling. Uh, that's why they call it prickly heat. Okay, it's a constant prickling or itching sensation once you have that. And also you have a tiny blisters cases as a result of salt crystal forming in the sweat gland ducts. Okay. Also, the next disease of the skin is perspiration. Perspiration. Okay. I mean, everybody perspired. Okay, some people do it less than other, but some people is really excessive. Um, so what is it? What is perspiration? Perspiration is generally simulated by heat and it's the body ways of regulating temperature. So let's say you're very hot, okay, because people don't perspire when it's cold, right? When somebody is cold, you don't perspire. Usually it's when it's when you're very hot. So that's what it is. So excessive sweating or is caused by overacting sweat glands. So it's when your sweat glands is overacting. That's when you have excessive sweating. It may be confined to specific areas such as your palm of your hands, armpits, glands, feet, and also it may occur also all over the body. I have a friend who, whenever she's on the stress, palms of her hands, she sweat profusely, and you can see the dripping. Very, very. I never see that. First time I saw that. So it can be very obvious, perspiration. And what are the sign and symptom? I think it's very easy. It's an unpleasant body odor may occur if perspiration comes into contact with bacteria of your skin. In severe cases, the skin in affected area may become damp and damaged. So that individual may need shower more often, right? Okay, so what are the next one will be bruising, but bruising, we can put it in the disorder of the skin, but it's really a disorder of blood, heart, and circulation. Because if you have bruising, is related really with blood and circulation. So when we are talking about blood, heart, and circulation, then we will talk about bruising. But we can categorize it as well in skin diseases, as a skin disease. Sunburn, the next one. Sunburn um, it's into the category of skin disease. So what is sunburn? Everybody knows, especially people who lives in uh, tropical country like where I am in Florida, because it's very hot. So if you go, into the sun, you go to the beach, you don't put your sunscreen, then you most likely you're going to have sunburn. What is sunburn? Sunburn occurs on exposures to bright sunlight, and it's caused by the effect of ultra violet lights. Okay, because of the UV, the ultraviolet light, um, you will get the sunburn if you don't use um, sunscreen. But sometimes, even though people use the sunscreen, they still have sunburns. It is most likely to affect people with pale complexions or those who are unused to being in the sun. So they said that people who have fair skin, pale skin, fair skin, they are most likely to have sunburns. Um, People of color like me, we do have sunburn too, but it shows less. That's what it is, because we have too much melanin, so that's why it doesn't show. It's not as red as people who has light skin, but we also have sunburns. But people see it less because of the melanin we have more than people who have light skin. So, what are the sign of symptom? What is the presentation? So, people are going to have a redness of extreme soreness in affected area. So, that area who has the sunburn is going to be very red, and also it's painful. Okay, it's extreme soreness. People feel it, um, and also a sensation of heat in burn area, and that person can have blisters. In severe cases, blisters can appear. um, if you have sunburn, there is kind of home remedies with good. They said you can put yogurt in it, so that will help. So do some research and see, but see what you can put. Sunburn. Some people said toothpaste. So, and the next one is warts. The next skin disease is warts. So what is warts? Wart is a small hard growth, okay, usually brown or flesh colored on the skin. So that's what is wart. It's a flesh colored on the skin. It may be caused by any one of 30 strain of human papilloma virus. So this is the virus we call HPV. So HPV is a human papilloma virus, can cause the warts. It's a skin disease. Uh, so wart is highly contagious. So that's meaning it's very contagious. So if you have someone who have warts, you cannot touch it. Okay, you cannot. Let's say you have a child who have warts. It's good you wear gloves if you're going to, wash that child or shower that child, because warts is very, very contagious. Um, but not dangerous. Okay, it's contagious but not dangerous. It's not like cancer. And can occur more frequently when the immune system is compromised. So that's what. Okay. Um, so how, like the sign, there's no sign or symptom. It's just the lesion. You're going to see the flesh colored lesion on your skin. This is the skin lesion. So this is what. Um, and the next one is dandruff. So as you can see, there's more than 20 skin diseases which uh, related to skin. So the next one will be dandruff. Dandruff is a very common um, skin, but it's not really. I mean, it is your scalp. Okay, it's in your scalp. So the how to say, dandruffs can be well treated by a primary care provider, but also if you cannot control it, if it's really severe, dermatologists, they are the one who's going to help you to control that. Okay, what is dandruff? Dandruff is occur when the fine cells of the outer layer of the skin on your scalp are shed in faster rate than normal. So that's what it is. Okay, so when you have the 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 shedding, you have a lot of shedding in your scalp. That's what it is. So causing the characteristic flakes of skin, of dead skin. uh, why that happen? It is caused by a disorder of the sebaceous gland. So this is a gland called sebaceous gland. It doesn't function well. That's why it's happening. Okay. If too little sebum is secreted the air, your hair is dry, and dandruff appear as white flake. So when you have white flakes in your scalp, that's how they call it, the dandruff. And also, if too much sebum is produced, the air is greasy. The sebum, is produced by the sebaceous gland. It's greasy, and they call it the dandruff yellow. So the flake are usually most obvious after brushing or combing the hair. And I can tell you, it's very itchy too. Okay, it's very itchy. Which loosening them. Okay, once you brush or comb your hair, is loosening the flakes. Certain type of seborrheic dermatitis are also responsible for dandruff, which will cause inflammation and itchiness in addition to flaking. So that will when you have dandruff, beside the flakiness, is the flakes, you're going to have inflammation, and also you're going to have itching. It's very, very itchy. Thanks God they have good shampoo, they have good lotions, topical lotion you can use, is very efficacious. So as I said, the primary care provider, they can treat that, or also if really you have severe type of dandruff, it's good you see a dermatologist that will help you. The next one, we have hair loss. Okay, everybody knows what is hair loss. Okay, and the hair loss can affect both sex. Okay, both sexes can affect female and male. It's not necessarily male. So hair loss is it's a normal. It is normal to shed. Okay, normally it is normal to shed. Let's they said 150 hairs per day. Normally, okay. But sometimes some people shed more. Okay, sometimes it can cause by hereditary. Hereditary. You can see some family member they are prone, you know, to lose more hair. Like the men, they are bald, they become bald um, younger than others. Okay, so they have different causes of that. Okay, age is one, right? And other causes of hair loss can be severe illness with high fever, pregnancy and childhood shock, stress, damage to the skin from burn, infection, radiation, chemical injury. And also skin cancer can cause that to chemo therapy. Chemo therapy is when somebody have cancer and this is the treatment they get. Most of the time they lose their hair, but their hair will come back. But one of the complication of chemo is hair loss, and also excess of vitamin A can cause that. Okay, when you that's why the vitamin A, I had I had a video on vitamins way back. Is if somebody wants to watch it, that's fine. Um, we have those vitamin A deck, A, D, E, K. Okay, there's those four vitamins. This is a side note because we are talking about the vitamins. Um, so those four vitamin A, D, E, K, they are liposoluble. That's meaning we need fat. They need fat to be dissolved. So those vitamins, you shouldn't take it like that. You know, you should make you should really make sure that you need it, you are deficiency, and you take it because like you see that excess of vitamin A can cause hair loss. So people have to be careful, okay? Um, and also, when you have hypothyroidism, you know, your thyroid gland doesn't function well. That can cause that also, and also syphilis. Syphilis is uh, sexually transmitted disease, syphilis, that can cause that too. So that's hair loss. So, you know, there's not really sign or symptom. You know, your hair, you lose your hair, you're going to see it. It shows. Um, the next one is balls. Balls. I don't know how to really say it. It's balls. Balls. BOILS. I'm sure English people won't say it like me because I'm Creole. So, boils. Yeah, boils. What is that? Is a swollen, pus-filled area occurring on the site of an infected air follicles. So boils, that's what it is. It's like an abscess, but it's not an abscess. It's different. But you know, it's very painful. So they said the Staphylococcus bacteria is usually responsible. So is an infection. But other causes may include eczema. Eczema can cause that too. Can cause you have balls. Beside eczema, scabies can cause that. Diabetes can cause that when people have diabetes, poor personal hygiene, and obesity. Okay, people who are obese, overweight. Boils begin as a painful red lumps. Okay, then hardens. It become hard and form a yellow head. Okay, and also please, it's no good. Somebody have the tendency to pop it up, to pop the ball. It's no good because that can, you that this is not the right way to do it. It's good you go to see your provider, and then they can prescribe you antibiotics, medication to treat that. The most common areas for boils to appear are the back of the neck, because this is where your hair follicles they are. Um, Also, the glands, okay, between your legs and your armpits, under your arms. A balls of an eyelash is known as a sty. So if you have a ball in your eyelid, they call it a sty. Um, so what is the sign or symptom? Okay, it's a burning, throbbing sensation in and around the affected area. So if you have the balls, you have the lesion, you're going to feel a burning and throbbing sensation around it. Sensitivity to the slightest touch one pause as form. It's very sensitive. Okay, so it's painful. The next one, uh, the next skin disease, it's it's called SARS. Cold SARS. This is the next one. Okay. So what is called SARS? What is cold sores are painful fluid-filled blisters which cross over after bursting. It's very, very painful. They usually appear on the mouth and around the lips or nose, sometimes in clusters. So that's when we really show, it's um it's called SARS. And also they are caused by viral infection. This is a viral infection caused by herpes simplex. Okay, that virus name is herpes simplex. This is what caused it. The virus is harbored by most people most of the time. So we most of people we have that virus, but for some reason when your uh, immune system they are compromised, when so that's when they come up. Okay, so they said uh, so most of people we have it in our body, but it's most likely to cause problem when the immune system is compromised dealing with other viral infections such as a cold, or when one is run down. Cold sore are highly contagious, so it's a very highly contagious um, disease, skin disease. Okay, so caution for uh, cold sore. What is the caution? They said cold sores are infectious. Wash hands carefully after applying any lotion, because they sell medications for that. And use a personal towel. I will advise, even though it's for you, even though you are going to use it on your body, I will advise um, to use a gloves. If you have cold sores and you are going to use like a topical cream, what have you, just use a gloves, and then after that you toss it. You toss the gloves because it's very contagious. That's why. The next one is abscess. Abscess. What is an abscess? An abscess is a pocket of pus, okay, which may occur in any bacterial infected area of your body. So white blood cells are sent by the body defense to attack the bacteria. So that's why you have an abscess. Um, and they said an abscess is very painful. So once you have an abscess, you will know it because it's very painful. In the beginning, it's hard, and after that, it can be soft. So what are the signs and symptoms of an abscess? Swelling, pain, and discomfort in the affected area. So the site that you have it, the place that you have is going to be very painful, and you're going to have swelling there too. So the abscess is and surrounding area may feel hot to touch. Okay, you may have fever, you may have nausea, and also you may be sweating as well. Okay, so once you have that, so consult your um, primary care provider so they can give you something. Or if it's a big abscess, maybe they need to refer you to general surgery to IND for incision and drainage. Okay, because some abscess won't resolve by itself, so then they need to open it up, drain the pus, and then do they're going to give you, of course they will give you antibiotics, and you need to do dressing, in order for that um, to heal. And so the next disease of the skin is acne. So acne, especially in puberty, especially in the adolescent, is very common. Is very frequent or common. So what is an acne? An acne is the skin disorder most common among adolescents. It is caused by the hormonal changes at puberty. So because of the hormones, so the adolescent they have the acne. Skin. It's a skin lesion they have all over their face, sometimes their torso, and also young adults also can have that too. Also. So the symptom of acne is red spot. Spot may become inflamed and infected, in which cases they are extremely painful. And also, as I said, primary care provider can treat that. Or if you really have a severe type of acne, it's good you go see a dermatologist, a doctor who specializes in skin, so they can treat you better. And the next skin disease is impetigo. Um, impetigo. Some healthcare professionals confuse impetigo with shingles. Impetigo and shingles is two different things. I mean, it's not the same thing at all. So once you see impetigo, you will always remember. So what is impetigo? It's a skin disease. It's a highly contagious skin disease caused by bacteria such as streptococci or staphylococci. Okay, so what is that? Is that your skin become red? And small fluid feel like blisters. You have blisters, and so the blisters tend to burst, leaving moist weeping area. Okay, so this is very contagious and you need to get treated. So you need to see your provider so they can give you medication, and that can spread rapidly to other parts of your body. So okay, so the symptom is reddening of affected area. So the affected area is red. Small fluid filled blisters, which often burst and weep, then dry out to form a yellow crust. itching, very rarely a, a kidney inflammation or blood, very rarely, okay, they said a kidney inflammation and blood poisoning may develop. So that's why it's very important. It's imperative to seek help as soon as possible. As soon as you see those skin lesions, you go to see your doctor or your nurse practitioner or physician assistant so they can treat you. Or if they can't, if they see it's very severe, they can refer you to a skin doctor. The next one is nail problems. So there's different type, of nail uh, uh, problems, and there's medication also. So the nail form a shield at the end of the fingers and toes. Okay, the nail itself is colorless. That's meaning there's no color in your nails and transparent, but appear pink because of the blood vessels. Okay, um, so people can have disease of uh, the fingernails, the toenails. Okay, if you have a disease of your fingernails, it's good you see your provider. But if it's your toenails, you have to see your foot doctor, your podiatrist. Um, so the next one is edema. The next skin disorder, edema, because it's affect, it's inflammation, but it's affect your skin. It can be also circulation system issue problem, but because it's affecting your skin, so edema it's fall into skin disorder. So what is edema? Edema is swelling and puffiness of tissue uh, due to fluid retention, right? It is an obvious physical symptom of a number of disorders, including kidney disease. So people have edema. So edema is the swelling. It's the swelling of the skin. It can be your arms, your feet. It can be your ankles. Okay. Um, so the symptom that once you have that, it can cause by different it can have different reason why people have edema. One of the reason is kidney disease. Heart failure can cause that. Cirrhosis of the liver is when your liver is inflamed. You have inflammation of liver. That's why they call cirrhosis of the liver. Edema may also occur as a result of injury. Also, like say somebody injured, so that can cause that as well. Um, what are the symptoms of eczema? Sinus symptom. Okay, edema may be accompanied by weight gain and breathing difficulty. So if you have somebody have weight gain, okay, or somebody they cannot breathe, maybe they have excess fluids, in their body, can cause that. The next disease of the skin, it's scabies. Scabies. Okay. So what is scabies? Scabies is an infestation of the skin by the mites. It's a mite called um, Sarcoptes scabii. So the mites, this is the mites who cause that, or itch mite. They call it itch mite. So you can have scabies on the side of your fingers. You can have scabies on your elbow, the groins, between your legs, your buttocks, your nipples, your uh, penis area. Okay. So the newly hatched mites reach adulthood within 14 days. So that's why when we treat scabies, we treat day 1 and then day 14, to make sure that we kill all the mites, all the eggs, and everything. Scabies is extremely infectious, okay, and can be transmitted by direct and indirect contact. So once somebody have scabies, you have to isolate that person. That person need to stay by himself or herself, in their room, and we need to wash their linens separately and everything, because it's very contagious and it spread fast. Um, the one of the places we can attest that scabies spread very fast. It's in nursing home. In nursing home, once you have one people have scabies, you can make sure that we're going to have more because it spreads so fast. It's very contagious. So the symptoms, other symptom is intense itching. Yeah, it's very, very itchy, and particularly at night. And also a rash may also they have a rash which may become infected as a result of scratching. So if that person, because that person going to scratch a lot because it's very, very itchy, so they can have a super imposed infection because of that. Also, we have cellulite. Also, can be a skin disorder as well. So the cellulite believing to be accumulation of fat under the skin. That's what we call cellulite. Cellulite. Okay. It's recognizable by its characteristic orange peel look. So also they said the uneven appearance result from the uh, thickened fat cells, fluid, and toxin. Cellulite, it is more prevalent. We find it more often in women than men. Okay, we don't know why. It is thought to have some link to female hormones. They said the main reason that cellulite affect women more than men, maybe because of the hormonal issue. Possible triggers for cellulite are poor circulation, alcohol, refined sugar, and caffeine, which contribute to the buildup of toxin in the body. Cellulite is not generally recognized as a medical condition by many doctors. Okay, they don't. Persistent on unsightly fat is often a deposit for toxin, either environmental or dietary. Exercise, skin brushing, massage, and eating as many organic and as few processed foods as possible may help. So, so they said if you exercise, if you do skin brushing, you massage, massage, you do massage, and eating as many organic and as few processed foods, that can help you have less that. Okay, so that's cellulite. That's for that. And also, okay, the symptoms. So, how do you know if you have it? So they said the areas of the skin with the dimple orange peel appearance, which may be slightly tender. These patches occur predominantly on the buttocks. This is where you can have cellulite on the buttocks, hip, thighs, and upper arms. Okay, so if you have like upper arms right here, you can have it. Your buttocks, um, yeah, and your thigh. And also we can have We can have corns and calluses. Corns. So this is a disorder of the skin. What is corn and calluses? A callus is a hardened and thickened area of the skin area as a result of constant friction. So when we see constant friction, we think about shoes, right? So if you wear shoes, especially the shoes is too tight, so it's friction constantly to your toe, so you can develop corns or calluses. So the skin cells respond to the friction by reproducing, which result in the characteristic hardening of skin. Calluses generally appears on the fingers and toes, knee, palm of your hands, and sole of the feet. When a callus on a toe joint become painful, it is known as the corn. So the pain is caused by pressure on nerve ending. Soft corn can appear between the toes. Manual uh, laborers are prone to uh, calluses. Yeah, people who use their hand, to work, so you can see those diseases in their hands. And after that, we have athlete's foot. So to go back to corns and calluses, so um, the specialist who can deal with that is podiatrist, the foot doctor. The foot doctor, they are good with that. They can, you know, trim the corns, clean the corns or calluses, and they can give you medication also to help you also. If it's caused by the shoe, they have the padding. They can prescribe you, can help you out with that. So the next one is athlete's foot. Athlete's foot. Okay, so athlete's foot. What is it? Athlete's foot or tinea pedis. This is another name for that. It's a fungal infection. It's caused by fungus, which attack the warm, moist area between the toes, more commonly between the fourth and fifth toes. It is highly infectious, spreading through close physical contact. Okay. Um, so they said once you have it, once somebody has athlete foot, it's very persistent. It's usually affect people with particularly sweaty feet because that's why the moistures, you stays, and those whose personal hygiene is inadequate. That's why personal hygiene is very important because that can cause so many diseases. Beside the athlete food that can cause, what we saw before, the scabies and what have you. So, what is the symptoms? Sinus symptoms somebody has athlete foot. Discomfort and itching in the affected area. So it's very discomfort, that there is itching, painful crack in the skin, peeling skin, blisters. They can have that. Dry and scaly or damp or blistered skin, unpleasant odor because it's fungus. So fungus, something we're going to have that. In severe cases, the toenails may crumble. So if you have athlete's foot, you need to see a foot doctor, a podiatrist that can help you with that. And the next one is child blends. We're not, it's not common, that name, but child blend. We don't see that. I don't think it's that common. Okay, so what is child blend? Child blend is a circular, it's round, raised, red swelling appearing on the fingers or toes, during cold weather. So it's when it's cold. So thanks God we are in Florida. That's why I don't know that, because I never see that. So they said that disease, that condition the child blends, it's a circular raised red swelling appearing on the fingers or toes during cold weather. It is caused by the narrowing of small arteries in the cold, which restrict the flow of the blood. Okay, because of the cold, the flow of the blood is restricted. That caused a circular raised lesion. This lead to tissue damage in the area concerned, from shortage of oxygen and glucose fuels, and bacteria may also accumulate there. So what are the symptoms? Pain, itching in the area of infected area, swelling and redness. So that condition we found it most likely in cold country because of the uh, restrict of the blood flow because of the cold. Um, I think that will be it for today for the video. The next the next educational video will be about high disease. Is very it's going to be very interesting. Um, yeah. So the most important things what we need to know, okay, it's when we have a condition, which system is affected, because we have so many systems. We have circulatory system, we have pulmonary system, we have muscular system, we have nervous system, we have what system we have? We have digestive system, we have lymphatic, we have so many systems. So it's good we know which system is infected. Okay, like today, all the condition I just talk about, they're all into one system: skin and hair and hair, skin, the skin system. So we know, once we talk about that, automatically we know which specialist we need to see. Okay, if you have a primary care physician or provider, I don't like to say physician, provider. Okay, if you have a primary care provider who can treat it, fine. But if you have severe cases of eczema, psoriasis, um, warts, hair loss, etc., it's good you see dermatologist. The skin doctor, they are the one who specialize to treat those conditions. Okay, so before we end, I always like um, to remind people that to stay healthy, to cherish our health, because our health is priceless, right? It's priceless. There's no price we can put on our health. There's no price we can put on being healthy. So we have to do everything we can to stay healthy, by exercising, eating a balanced meal. But what is a balanced meal? You have your carb, you have your fruits, you have your vegetables, you have your proteins. Try to eat less refined sugars, drink plenty water. Okay, tea, if you like tea is very good, like green tea. They have different tea, so you use them. And also, not least, but try to reduce your stress level. Stress, I will not stop to emphasize enough. Stress is very detrimental to people's health. That can cause anything. That can cause all those symptoms, all those diseases, stress. So as much as we can, reduce your stress as much as we can. So I know it's not easy, but some stress you can remove it. If it's you have to weight the pro and the con. If you have something in your life, you have to analyze it. Is it worth it to have those kind of stress in my life? If it's not, get rid of it. You don't care what it is. So you just have to weigh your pro and con, and try to reduce your stress as much as possible, so to help your health. So because stress affect all area of your health, you know your physic, your mental, you name it. And then keep loving people. So we have so many things in this world, and to me is boiled down with one thing. It's people really, is the love of people is not there. So we have to do our part, try to love people, even though people hurt us. You just pray. You just pray for them. And it doesn't mean they are going to be your friend back, but just love everybody and try to be the best you can every day. And on that, I wish you the best of health until next time.